Right.
Leafy greens, so all leafy greens. So spinach and kale and arugula are all going to be excellent sources of folate.
So if you're interested in becoming pregnant, start then. I'm Dr. Georgia Witkin, and with me is Dr. Serena Chen. She's Division Director of Reproductive Medicine at IRMS at St. Barnabas, and Jeannie Petrucci. She is founder of Living Plate. She's a registered dietitian. You are the perfect people to be speaking to, and let's do some true-false. You can guess along. True or false, your diet can make you infertile. True or false?
I'm going to waver and say it could go both ways. I do believe that obesity is actually one of the top causes for infertility in this country. So in a way, yes, your diet can make you infertile.
So let's talk about that connection. Obesity means that you're changing your hormones because of availability of estrogen. I mean, what's the link?
That's a great point. Obesity is not you're just carrying extra weight. Extra adipose tissue is an active organ, and it does produce hormones, and it does produce a lot of inflammation and inflammatory molecules. So we think it's actively causing damage to your tissues.
So that's the link.
That's what we think.
Okay.
Yes.
How about for men? True or false? Diet has an effect on male fertility.
True.
Absolutely. And we now have a lot more hard data on male preconception health, and a huge part of good male preconception health is diet. And male obesity, we know, is closely linked with embryo development and poor embryo development and other issues like that. So the males are also actually having a direct impact on pregnancy through their health.
Sounds like the good news is that if you improve your nutrition and you improve your weight, you might be able to improve your fertility unless there's an underlying organic cause.
You may. Yes, absolutely.
Okay.
I think absolutely. Like, obviously, everybody needs a full evaluation. We have to check the tubes, we have to check the sperm, but overall, good nutrition, good health, healthy weight, all of that can raise the bar and create a more optimal environment, and that makes our job as physicians easier.
Now, you know the media has a lot about being overweight and all of the problems. How about being underweight? Does that have a link to infertility as well? If you're not making enough estrogen, let's say, because you don't have adipose tissue, is that a problem as well? Can you be too thin?
Yeah, certainly. I think good nutrition is the overall message, and maintaining a healthy body weight and body composition as defined by your healthcare practitioner, because like Dr. Chen said, it really is going to be different for everyone.
My concern is this. The media also has a lot about the fertility diet. That's a very popular topic now. And the suggestion is that if you eat right and do everything right, you'll be able to conceive. Any danger?
It's
that
not
message?
a simple equation, and that would be my message to patients. It's not a simple equation, do this and this will happen. But if you do follow proper nutrition, evidence-based nutrition as it relates to fertility, you may improve your fertility. So it's not a do this and this will happen.
You might still need to do, say, in vitro fertilization or things like that, but believe me, it's so much easier to treat a patient with IVF when they're on a healthy diet, when they're a healthy weight. It definitely makes our outcomes better. So yes, people may still need conventional medical treatments, but creating a healthy environment for that makes a huge difference.
For fertility and pregnancy outcomes as well.
Oh,
correct?
pregnancy,
Yes.
absolutely. Huge.
Let's also say out loud right here that age and physical conditions, like ovarian problems, are frequently the determinant of what's going on, that you can be healthy and you can be fit and you can eat right and still have a fertility problem. Because I know certainly women tend to blame themselves when they get a diagnosis. If I only ate differently, if I only lose weight, and sometimes it's not that
no,
at
it's
all.
definitely, it's not about blame. I think it's about moving forward. We don't want to regret the past, but now that we're in this place where we're trying to get pregnant and maybe we're struggling, there's a lot of reasons to look forward to being healthier, and everybody can change their health. But you're right, there's that aspect of it where people sometimes feel betrayed because I've been so healthy, I've been working so
Exactly.
hard, and yet here I am in the doctor's office, right?
Exactly.
And
like you said, a little bit of it's out of your control,
some
right?
of it is not.
So the nutrition
Age being number one.
Age being number
and
one.
physical conditions
Exactly,
being number two.
out of control.
That's right.
So thinking about what can I control?
That's right.
And that's where
That's
where we
things
specialize.
like
That's things
yeah,
like this,
food and
following a
nutrition
healthy
and
diet, yes.
exercise.
Right. If you're in a situation where you're being treated and you have no sense of control, you can't predict what's coming next,
Right.
at least this is something you can do for yourself.
Sure.
Okay,
So
next.
just
go
to
ahead.
make one point about that, like
Sure.
this whole thing about we aging, it really seems, as you said, that the biological clock is in the ovary. But exercise and healthy eating, you can slow your chronological age in a lot of other tissues in your body. Just
That's
the
a great
problem,
way to put
right?
it.
Just the
Great way
problem
to
is
put
the
it.
ovaries. The ovaries keep ticking, but things like your whole body exercising, you can slow the biological clock in a lot of parts of your body, and that does make a huge difference for pregnancy.
For carrying,
Yes.
for delivering.
Exactly. Even though your ovaries might still need some help.
Well, nature thought we would be eaten by a bear by the time we were 30, apparently. Not still going to school and just looking for mates. True or false?
True.
You should be eating for your baby before you're even pregnant.
Yes.
Yes.
Yes, and that's
Yes.
we're struggling with that, and that's why I'm so glad you're doing this series, because it's not just people, but it's all of the healthcare system, right? We're treating disease instead of making people better and more well. And the truth is now that some of these huge new studies are out, hopefully we'll start to shift our focus and realize that planning for a healthy pregnancy actually kind of in some ways begins at birth, in some ways begins at the womb. So that if you have an unhealthy pregnancy, your child then is more likely later on to have her own unhealthy pregnancy.
Let's talk about pre-pregnancy. Most women have babies that are developing their brain and neural tube week 3 and 4 of pregnancy.
Yes.
They may not even know they're pregnant yet. So what should they be eating if they're interested in becoming pregnant that will help the development of the baby?
So there are several things to consider. Supplementation, they should speak to their healthcare practitioner about supplementing with certain micronutrients that will aid in the development of the baby's
That's prenatal vitamins.
prenatal vitamins. I'm sorry.
Folic acid.
Yes, folic acid. Yeah,
for the brain.
so that is important
the baby.
pre-pregnancy. So even if you're thinking about
Pre-pregnancy.
it, that's always a great idea. But then also eating foods that are rich in folate. So folate.
Give us an example.
Okay.
What are some foods?
So we have 2 really great examples here. So asparagus is high in folate. I have something behind Dr. Chen here. Oranges. Oranges are one of the. Here, why don't we just grab them? Okay, so oranges. We would prefer consumption of the entire orange because then you're getting fiber, which is also beneficial for health. So oranges are also rich in folate.
The skin too?
No, just the inside.
Okay, just the inside.
Just the inside.
But
yeah.
that brings up a really good point, Jeannie, because I have a lot of patients saying, I juice every day.
Oh,
and
yeah.
then I think they're getting a lot of sugar, right?
Yeah, so juicing removes the fiber. And the fiber is really important for a lot of reasons.
So
And
whole foods.
whole foods, yes. And just a note about food safety, if I can take a second here to talk
Please.
about that. So anytime you have a food that has a rind, or really any fruit or vegetable for that matter, you really do want to wash it because even though you're only consuming the inside, there could be bacteria and could increase your risk for contamination. So you want to wash it because when you cut it with a knife, that bacteria could go right through the middle. Things like cantaloupe and watermelon. So making sure we want you to eat these fruits and vegetables.
Soap and water, Purell. What should we be using?
There's some really nice fruit and vegetable washes that you can get at your store, but you could also use a solution of vinegar to water. 1/3 vinegar, like white wine vinegar, to water, and give it a good washing with a little scrub brush, and then you're good to go. And then when you cut it, you'll be safe. Yeah, and also remember, so folate is found in foliage. Right, it shares
That's a
the
good
root,
way
the
to
Latin
remember.
root. So
Yeah.
think foliage. So leafy greens. Right. Leafy greens. So all leafy greens. So spinach and kale and arugula are all going to be excellent sources of folate.
So if you're interested in becoming pregnant, start then.
Yes, yes. Speak
Don't
to your
wait.
healthcare practitioner about supplementation, and also, consume a wide variety of fruits and vegetables that are
really,
known to be high in folate.
Georgia, once women are of reproductive age, they're either trying to get pregnant or trying not to get pregnant, right? And then we go through menopause. So everybody should be thinking about health one way or the other, right?
Yeah.
That's one way of looking at it.
So I like to simplify things. So
Right.
if you're trying not to get pregnant, you need to have good contraception, safe contraception, practice STD protection, and just to be healthy, just to live your life. And if you're not actively using contraception, then even if you're not really trying for a baby, you could still be pregnant anytime. And you really should be prepared with taking a vitamin and, eating healthy and all of those things.
Let's talk about that. When you are not trying to become pregnant, you spend your life hearing about fats. What fats are good, which fats aren't good, watch this. But once you're interested in becoming pregnant, there's really a change in what kinds of fats you need. So let's talk about that for a minute, because I think most of us really don't know the difference between fats. And we're all going for low fat this, low fat that. You're pregnant. You don't want low fat anymore.
No, not at all. Not at all. There are really two things that you want to think about. Full fat dairy. So looking for things like yogurt, which we recommend to our clients frequently, with a higher fat content. An excellent way to consume full fat dairy. And we have an example that we'll show you in a little while. But then also higher quality fats that come mono and polyunsaturated fats. Things like avocados and olive oil all have healthy fats that are really critical for brain function and just healthy cell metabolism.
But they're not bad for you.
No.
The fat, if you're not trying to get pregnant, right?
Right, just should be part of your healthy diet anyway.
Right.
Yeah.
So I think our society seems to overemphasize the low fat, right?
It's changing a little bit.
It is starting to change.
Yeah.
But I
When you
think
look at mother's milk and you see that the major ingredient
Yes.
is full
Yes.
fats
Yes.
and then some protein and some carbs, it seems to me like that is really the recipe for what's good for human beings, if that's what's in mother's milk.
Can you imagine if mother's milk were low fat?
Yeah.
The child would be hungry all the time.
Yeah.
Right? The fat is really to help with satiety, to help you feel full and to extend time between feedings. The same applies for adults. So if I have some full fat yogurt in the morning versus a low fat yogurt, I'm likely to not be as hungry until I get to lunch, which really gets back to a behavior that helps with healthy weight maintenance.
Right.
Yeah.
Exactly. So this emphasis on everything has to be low fat, sometimes you end up paying for it on the other side, like
Sure.
eating more
Eating
carbs.
more carbs.
and-
Yeah, exactly.
Yeah, because you're not as full. Okay, so
Exactly.
you've heard it here. You have permission to have
Full fat.
full
Yes.
fat as long as it's healthy and limited.
And nuts too. I forgot to nuts.
Oh,
and
yeah, nuts.
nuts, seeds,
Yeah.
avocados, all good.